Welcome to Business Connection. I'm Liz Spencer. We're on location today at Edward Hospital, and we're here to learn about how Edward-Elmhurst Health is leading the way in cardiac care. Edward Hospital and Edward-Elmhurst Healthcare is becoming known as cardiac care center leaders. Tell me a little bit about how this came into be and what you're doing now.
Well, what we're really excited about now is our newly named Cardiac Innovations and Structural Heart Center. And this program provides complex, minimally invasive procedures for patients who are told they are too high risk for traditional open heart surgery. And these patients now have a chance at a better quality of life when they really had no other solutions to manage their cardiovascular disease. And what's really important about this for Naperville is most community hospitals don't offer these procedures. You used to have to go to the medical centers and being part of research trials and go into these major centers to have these procedures done, and now we have it at Edward, which is in our community and for our patient base.
I think that's fantastic to be able to get the level of care here in a very warm and inviting center, because it's a scary time.
It is.
It's the heart.
It is very scary, and it's even more scary when you're told there is no more options for you. And we really take these patients by the hand and walk them through the entire process of their care. We actually have a patient navigator who, from the first phone call when a patient is referred to us, they've told they have no other options, and then we take them by the hand and walk them through the process and take care of them, and it's amazing to see how grateful they are once they have the procedure done and their quality of life is improved.
Well, and I'm also so impressed by how efficient and kind your staff is, but how quickly all this is done. You're not in the hospital for very long.
No, it's only actually a couple days, and we actually try to bring the patient in when they're referred to us. They get all their testing done in one day and then come back and have the procedure and are here a few days, and then they go home.
Well, and I think that not only does it make it more efficient, but it also provides them with more comfort to be able to go home quickly and makes recovery easier.
Absolutely, and these are some of the sickest of the sick patients, of course, because they were told they were not eligible for open heart surgery. So going through this procedure is scary for them, but then the fact that we can do it and they go home in a couple of days and have really good outcomes is really life-saving for them.
Heart care has come so far in the last 30 years. Give us your opinion on what you think moved it forward, the technology, the need, perhaps? Combination of the both?
What I think that did it for us at Edward is our physician partners. Mm-hmm. Our physician partners in cardiovascular surgery, Dr. Foy and Dr. Goodwin in cardiology, have a unique partnership. It's palpable here at Edward that we work together. We're a team. And then with the clinical staff, we live and breathe cardiovascular care. And then we have excellent relationships. Administration and our physicians work really well together to really do what's best, what we think is right for the organization and for our patients. So it's really all about being a team.
Well, it's exciting, and I often don't think we think about healthcare as a team, because we usually only see one person.
Right.
But when you're coming in for such a high-level care, it is a routine approach here.
It is everyone who touches you, from the person who registers you at the front desk to the nurses and the technicians in the procedural areas, to our physicians, to our management team and leadership who help put the programs together. So it is collaborative, and I probably think one of the most significant reasons it's done so well here at Edward is also because of our partnership between the cardiologists and the cardiac surgeons. They are truly collaborative partners.
Well, and they need to be, because they go back and forth so much.
Yes.
Well, thank you for taking a few moments to share about this great facility right here in Naperville. I am so glad that you are in our hometown. So thank you for joining me.
Thank you for having me.
Gentlemen, thanks for joining me. It's exciting to have you both on the show. Dr. Goodwin, cardiac care has come a long way. So tell me a little bit about this center and how far you've come.
Well, I think cardiac care evolved. When I first trained, if you died from a heart attack, it was about a 25% chance of dying with a heart attack. Today it's less than 1%. Here at Edward, when I first came here, it was a gravel parking lot, and there really wasn't a heart center. And today it's a leading regional medical center for cardiac care for a wide range of procedures that people come from multiple states for us to provide care.
That's awesome. Dr. Foy, what does it mean for patients and people to have access to this high-level care?
This is really university level cardiology and cardiac surgery care delivered in a community hospital setting. So we're able to pretty much provide all of what you might receive at the major academic institutions, but do it in a way where there's more attention to detail, more attention to patient care. It's more what I would call boutique care. There's phenomenal doctors and nurses. I think we know from experience that the patients who come here and receive this very high-end care, they're appreciative of the technology itself, but they're really appreciative of the way in which it's delivered. It's personal care, but it's very high-end care.
Well, and it's a scary time. We're dealing with the heart, so it's nice to have the personal touch and the extra attention. Dr. Goodwin mentioned that we have come a long way. Tell me a little bit about the procedures that you do.
Well, there's a lot of procedures we do here that prior to the leading center in Chicago. So there's a procedure called Ctos. Basically, if you have an artery that's been closed for a long time, it used to be thought you couldn't open that. This year we'll do 200 of those, which puts us as the third largest site in the United States. It's for people who have ongoing symptoms who've been told nothing else can be done for them. There's now a procedure we can do that helps those people, and we get referrals from multiple states and throughout Chicagoland. There's another procedure called the Watchman Device. There's a common rhythm problem called atrial fibrillation, which is an irregular rhythm. And one of the issues with atrial fibrillation is you have a higher incidence of stroke. For some people, they can't take a blood thinner, Coumadin, or other types of blood thinners. And so by putting this device in the heart, you no longer have to take any blood thinners. So it's a big change. We're the largest inserter of this in the 7-state region for the Watchman procedure. And lastly, some people have a leakage of a valve where normally they might get surgery. Some people are just too high a risk for surgery. So there's the mitral valve, which is one of the valves in the heart. And when that leaks, we can go into the heart, put a small clip into the heart, and get rid of the leakage without having any open heart surgery. So if you come in on a Thursday, you go home on Friday, and your valve has been taken care of, that is only for people who are too high risk of surgery. If you're a low risk for surgery or medium risk, Dr. Foy would be doing that procedure.
Wow. Wow, it's so far. We've come so far in 25 years as technology. Dr. Foy, tell me a little bit about what you do and the procedures you see.
Well, certainly there's run-of-the-mill, I would say, heart surgery, coronary bypass surgery, and valve surgery. We do a lot of both of those here, and the results are always superior to national norms. Year in and year out, that seems to be something that we accomplish. Additionally, there are other surgical procedures we do. One is called Lvad, stands for left ventricular assist device. This is basically an implantable pump for patients whose hearts are failing and they're facing imminent death from heart failure, and they're not heart transplant candidates. So it's a surgical procedure to implant a very small pump, and they can return to basically normal life living with an Lvad. So that's something that's very high end that we do here. Additionally, Dr. Goodwin and I have developed this Tavor program here. Tavor is an acronym for transcatheter aortic valve replacement, and it's a way again of replacing an aortic valve in someone who might be too sick for surgery or otherwise might not do well with surgery. This has been a huge leap in technology, probably the biggest thing I've seen in cardiology and cardiac surgery since the advent of coronary angioplasty. So we're seeing multiple patients every week. It's become very routine, very safe, and people now come, this is what they want. And there's reason they should want it because it works and it's easy.
Well, it's life-saving too. Gentlemen, thank you for stopping by and telling us a little bit about what you do.
Thank you so much. Have a great day.
Bye-bye.